So, I just got out of the hospital. Appendicitis. Emergency surgery. 3 days in recovery. And when I showed my American mom the bill, she literally started crying. Honey, this can't be right. I don't understand. But here's the thing, Mom. It is right. And when you see what I paid versus what you would have paid in America, you're not going to believe it. I'm going to break down every single cent and then compare it to what the exact same procedure costs in the United States in 2025. And I promise you, by the end of this video, you'll understand why she cried. But first, smash that subscribe button, because what I'm about to show you will blow your mind. Okay, so 2 weeks ago, I woke up at 3 a.m. with the worst pain I've ever felt in my life. Right here, like someone was stabbing me with a hot poker. I couldn't stand up straight. I was sweating. I knew something was really, really wrong. Now, in Australia, we have this thing called Medicare. It's our universal healthcare system. Everyone has it. It's free to get a Medicare card. So I did what any Australian would do. I called an ambulance. The ambulance came in 12 minutes. 2 paramedics. They gave me pain medication right there in my apartment, got me on a stretcher, and rushed me to the hospital. Cost of the ambulance ride with sirens, paramedics, and medication? In Australia, with my state's ambulance cover, $0. Now hold on to that number. Because in America, according to the latest 2025 data, the average ambulance ride costs between $1,200 and $2,500 without insurance. Australia, $0, USA. $1,200, $2,500. We haven't even gotten to the hospital yet. So I get to the emergency department at 4:30 a.m. I'm in agony. They triaged me immediately. That means they assessed how serious my condition was. Within 20 minutes, I'm in a private bay with a nurse taking my vitals. They ran blood tests. They did a CT scan. That's like a super detailed X-ray. The ER doctor examined me. By 7 a.m., they confirmed it. Acute appendicitis. My appendix was about to burst. I needed emergency surgery immediately. Cost for the ER visit, blood work, CT scan, doctor consultation, and diagnosis in Australia as a public patient? $0. In the United States right now, November 2025, the average emergency room visit alone costs $2,715, according to an analysis of 2.5 billion insurance claims. That's just to walk in the door. A CT scan in America? That'll run you anywhere from $500 to $3,000 depending on the hospital and whether you have insurance. Blood work? Another $200 to $500. Australia ER plus tests. $0, USA ER plus tests. $3,400, $6,200 plus, and we haven't even gotten to the surgery yet. My mom, who's been living in Texas for 30 years, she knows these numbers. She's seen these bills. That's why when I tell her what happens next, she loses it. By 9 a.m., I'm being wheeled into surgery. The procedure is called a laparoscopic appendectomy. They make 3 tiny incisions and remove your appendix using a camera and special instruments. It's less invasive than old-school open surgery. I had a full surgical team. The lead surgeon, an assisting surgeon, an anesthesiologist, 2 surgical nurses, and a recovery team. The surgery took about 45 minutes. Then I spent 2 hours in recovery coming out of anesthesia. Total cost for the surgery, anesthesia, surgical team, operating room, and recovery? $0. Because I was a public patient in a public hospital in Australia. Medicare covered everything. Now, in America, according to the latest 2025 healthcare data, an appendectomy in the United States averages $29,779, $29,779 for the same surgery, the same procedure, similar hospitals, qualified surgeons. Australia, $0, USA, $29,779. That's the average cost insurers pay. If you don't have insurance, It can go up to $35,000 to $50,000. Some hospitals charge even more. And even if you have insurance in America, you're still on the hook for deductibles, co-pays, and out-of-pocket maximums. The average American with insurance still pays $3,000 to $7,000 for an emergency appendectomy after insurance kicks in. Australia, no insurance needed, $0 USA with insurance. $3,000, $7,000 USA without insurance. $35,000, $50,000. This is an emergency surgery. This isn't elective. You can't shop around. If your appendix bursts, you can die. People don't have time to compare hospital prices or negotiate. After surgery, they kept me in the hospital for 3 days to make sure I was healing properly. I had my own room. Well, semi-private, but I ended up alone because the other bed was empty. I had nurses checking on me every 4 hours. They gave me IV antibiotics to prevent infection. Pain medication. I got 3 full meals a day. Hospital food isn't gourmet, but it's there. They monitored my vitals, changed my dressings, and made sure I could walk and eat before discharge. On day 3, the surgeon came back, checked my incisions, said everything looked great, and cleared me to go home with a prescription for antibiotics and pain medication. Total cost for 3 days in the hospital, all nursing care, medications, meals, and post-op surgeon visits, $0. In America, the average cost of a one-night hospital stay is $3,025, according to 2025 data. So 3 nights? You're looking at $9,000 to $12,000 minimum, and that's before you add in nursing care, medications, and the follow-up visits. Forbes reported in April 2025 that even with insurance, the average out-of-pocket cost for childbirth, which is usually a 2 to 3 day hospital stay, is $2,854 for vaginal delivery and $3,214 for a C-section. And that's with insurance. So if we're adding up my Australian hospital experience so far, ambulance, ER, CT scan, surgery, 3-day stay, all care and medications, ambulance. $0 ER and tests, $0 surgery, $0 3-day stay, $0 total, $0, 0. Everything was 0. The same treatment in America. American cost breakdown. Ambulance, $1,800 ER and tests. $5,000 surgery, $29,779 3-day stay. $10,000 total. $46,579, $46,579, almost $50,000. That's a brand new car. That's a down payment on a house. That's somebody's entire annual salary. Okay, so I'm discharged. I need to fill my prescriptions, 10 days of antibiotics and some pain medication. I walk to my local pharmacy with my paper scripts. Now, in Australia, we have something called the Pharmaceutical Benefits Scheme, PBS. It's a government program that subsidizes the cost of prescription medications. As of 2025, the maximum you pay for a PBS medication is $31.60 per prescription. If you have a concession card, like if you're a student, pensioner, or low income, it's just $7.70. I got my antibiotics and pain medication. Total cost? $63.20 for both prescriptions. This was my first out-of-pocket expense this entire time. In America, according to a shocking report from the Australia Institute in April 2025, Americans pay 8 to 50 times more for the exact same medications. The New York Post reported in August 2025 about a doctor who compared medication costs. Americans are paying tens of thousands of dollars for medicines that cost hundreds in Australia. And we're talking about the same drugs, same manufacturers, same pills. Without insurance, those same prescriptions in America could cost anywhere from $100 to $400, depending on the drug and pharmacy. Australia, $63.20 USA. $100, $400. So now, my grand total for this entire medical emergency, $63.20. So when I video called my mom and showed her my hospital paperwork, "Mom, I'm okay. I had emergency surgery. They took out my appendix." Mom, panicking. "Oh my God! Are you okay? How much is this going to cost you? That's what I wanted to talk to you about." Mom, confused. What am I looking at? That's my bill. For everything." Mom, voice rising. "This says zero. This can't be right. There's gotta be another bill coming." "Nope. That's it. I paid $63 at the pharmacy for prescriptions. That's my total cost." Mom, emotional. Do you understand that if this happened to you in Texas, you could have been charged $40,000, $50,000? Even with my insurance, you'd be paying thousands. We'd have to set up a payment plan. People go bankrupt over this." "I know, Mom. That's why I'm making this video. My mom has insurance through her employer. She pays over $400 a month in premiums. That's money that comes out of her paycheck every month just to have insurance. According to 2025 data, ACA marketplace premiums are increasing by an average of 26% in 2026. People are seeing their monthly premiums nearly double. And even with that expensive insurance, she still has a $3,000 deductible, meaning she has to pay the first $3,000 of medical costs out of pocket before insurance even starts covering anything. Monthly premium, $400. Annual premium, $4,800. Deductible, $3,000. Total, before insurance covers anything, $7,800 a year. So she's paying almost $8,000 a year just for the privilege of having insurance. And then she still has to pay thousands more if something actually happens. In Australia, I pay 2% of my taxable income to Medicare through my taxes. For someone earning $50,000 a year, that's $1,000 annually. And that covers everything. No deductibles, no co-pays, no networks, no pre-approvals. Australia, $1,000 a year, no other costs. USA, $7,800 a year plus out-of-pocket costs. Here's what a lot of people don't understand about healthcare costs. The United States spends more money per person on healthcare than any other developed country in the world. In 2025, according to research, the U.S. spends at least 40% more per person than anywhere else, including Australia. The U.S. spent $12,555 per person on healthcare in 2022, almost twice as much as other wealthy countries. Australia spent around $6,931 per person. The Commonwealth Fund's 2024 Mirror report ranked the U.S. healthcare system last among 10 high-income countries. Last in access to care. Last in equity. Last in health outcomes. Meanwhile, countries like Australia, the UK, Netherlands, and Germany, with universal healthcare systems, ranked at the top. This isn't about politics. This is about people. Real people who are rationing their insulin because they can't afford it. People who are calling Ubers instead of ambulances because they're scared of the bill. People who are going bankrupt because they got sick. According to recent data, more than 1 in 4 Americans report skipping doctor consultations, medical tests, or treatments because of cost. Let that sink in. 25% of people are avoiding medical care because they're terrified of the bill. Nobody should have to choose between their health and their financial survival. Nobody should have to set up a GoFundMe to pay for chemotherapy. Nobody should have to decide whether an ambulance is worth it when they're having a heart attack. So yeah, I showed my American mom my hospital bill, and she cried. Not because it was expensive, but because it was free. Because she realized that the system she's lived under her whole life, the system she thought was normal, is completely broken. Healthcare is a human right. Full stop. And every developed country except one has figured that out. If this video opened your eyes, hit that like button and share it. If you're American and you're tired of this system, leave a comment. If you're from another country with universal healthcare, tell us what it's like where you live. and subscribe to this channel, because I'm going to keep making videos comparing life in Australia versus America, the costs, the systems, the quality of life, because people deserve to know the truth. Oh, and Mom, I'm fine. The surgery went great. I love you. And maybe it's time to think about moving to Australia. Australia, $63.20. USA, $46,579. Plus, healthcare is a human right. Full stop. And every developed country except one has figured that out. That's the truth hidden behind the world's most expensive system. $63.20 versus $46,579.